I'd like now to introduce Katia Ferrar from the University of South Australia. Katia is a physiotherapist, lecturer and clinical and academic director of the Invictus Pathways program at the University of South Australia. Katia's broad research interests lie in evaluating the effects of physical activity on health and functioning of people with chronic health conditions. Please welcome Dr. Katia Ferrar.
I'd also like to say that I'm presenting on behalf of Dr. Max Nelson, who unfortunately can't be here today, and he really wanted to present with me, and also Professor Roger Eston, who's in the audience today. The Invictus Pathways program is what we believe to be a first in the world, wholly student-delivered, exercise-based wellbeing program for veterans and first responders. And it, as the name suggests, it was inspired by Prince Harry's Invictus Games and the power of adaptive sports to help veterans and first responders to set goals and reach life goals, but also sporting goals. And you can see there from the aims on the screen, our aims are for physical and mental wellbeing improvements, but also for self-empowerment and reintegration into the community. And all of our services at the Invictus Pathways program at the University of South Australia are free to all of the participants. So what is it exactly? So it's made up of two components. One component is the student-delivered exercise training program, and the other component is the community adaptive sports program. So I'll start by talking you through the student-delivered program. So this flowchart just gives you a bit of a rough idea about how the program works, and I'm going to step you through it. So participants, whether they be current serving or veterans or first responders, are either referred to the program or they contact Mark Reedy, who's here in the audience today, wanting to be involved. They may have physical or mental conditions that may benefit from the program. Mark assesses whether they are ready to commit to the program, and he also is integral to the effectiveness of this program because he acts as an ongoing mentor and support for the participants as well. So when they come in to the program, they then get to come and be assessed at our student-delivered clinics at the University of South Australia. So we have psychology, physiotherapy, podiatry and exercise physiology all on campus, all delivered by students. So they get to see the psychology students, and the primary goal of this assessment is for them, for the student psychologists, who are obviously under supervision, to get some handle on the mental wellbeing of the participants, so then they can give some advice to the rest of the student multidisciplinary team about how best to manage and make their journey through the program more effective. A secondary purpose of that assessment is also that the participants can actually access ongoing psychological services through the psychology clinic if and when they want to. And again, all of these services are free. They get to have a podiatry assessment unless they are obviously totally wheelchair bound. And that is predominantly, as you would imagine, a lower limb assessment, and they get to have a biomechanical assessment, and that is targeted to either their life goals that they may want to achieve or their sporting goals. So for example, if they wanted to start jogging, then obviously the podiatry students would do a running or a walking biomechanical assessment of that participant. They also get to have a physiotherapy consultation at our student-led physiotherapy clinic. The primary aim of this is obviously to identify any musculoskeletal injuries that the participant may be carrying or have a history of before, but also to actually do an assessment to see whether there are any deficits that may impact their performance, particularly if they're wanting to go on to sort of sporting endeavours. But those deficits may also interrupt with wanting to achieve life goals such as gardening or taking up a hobby. So you can see from the screen, looking for sort of posture and symmetry, strength and control. Again, if they have ongoing problems, all of the participants are able to access the physiotherapy clinic services free at any time. And then finally, they get to have an exercise physiology assessment. So this process is primarily for a risk assessment process, so looking for perhaps cardiovascular disease or diabetes or any other medical condition that obviously the multi-D student team needs to be aware of for safety reasons while they're going to exercise, but also to triage the participant towards the right exercise trainer, which is the next step along the pathway. And also there is a lot of goal setting that goes along during these sessions as well. So life goal setting and also those sort of sporting goals so that we can tailor the program to those individual needs. So after all of these individual assessments, they then send a report down to the High Performance Centre, and that is really important because we need our multidisciplinary teams to know what's going on in all the other sectors. Then they get to go for high performance testing. So this might be the fun bit for some people and maybe not for others. So again, dependent on the goals that they want to achieve, the High Performance Centre selects performance tests to conduct. So that might, as you can see in the picture there, might be a full VO2 max gas analysis test to exhaustion. Not for all participants, of course. So they are picked according to their goals and their aims. Then they also get a detailed report at the end of that time, which gives them obviously a baseline for when they come into the program. It gives them some training advice as well if they're going on to more competitive performance type sports. And also we rerun those high performance tests every 3 months. And so that gives the participants a document and something to look back on to be able to track their progress over time, which is really important for that sort of setting goals and self-motivation. But it's also really important data for us as the people who are running the program to be able to track the participants over time. So then when we've done all of those steps, the participants get to meet their student exercise trainers. So the participants get to train in, we've got 3 University of South Australia gyms. They get individualised training programs, again, specific to their baseline requirements and their goals and aims. Every 6 weeks they get developed, which is obviously best practice for a physical exercise program, and the Invictus Pathways program staff are there on hand to supervise those students and to guide them for their skill development. It's a unique placement for our students to experience. The participants get the opportunity to train up to 2 or 3 times a week, and that's up to them, and obviously that fluctuates depending on what's going on in their lives. For the students, it's really special and unique because it's one of the only training clinical placements that they do where they get to stay with their participants for a 12-month duration. And so that actually really gives our students an amazing opportunity to watch someone go through their life journey and their ups and downs and to develop an amazing rapport with these participants. For example, a lot of their other clinical placements are only 10 weeks long. We have some participants in the room, and I don't think they would disagree with me when I say that some of our participants are quite challenging. They have some complex physical and psychological needs, and so this is also an amazing opportunity for our students. And it's also one of the only opportunities for some of our training students where there is a competitive performance component to it, where they're helping a participant lead up to a competitive event. And so again, that's a really special opportunity. So that's the general flow of how the student exercise-based program runs. But like I said, there is also the community adaptive sports program. So I mentioned Mark Reedy before. Mark Reedy has been running these community adaptive sports programs for the Invictus Pathways program for the last few years. He has got an amazing network and an amazing ability to get community organisations on board to offer their services to the veterans and first responders in the program. So the type of programs that run under this banner are wheelchair sports, also kayaking, there's a swimming program, there's archery, very regular cycling. There's a very strong cycling theme in the South Australian ranks, and also a gym membership. So all of these sort of adaptive programs run regularly each week, and they run alongside the student-delivered program. So where the student-delivered program invites the participants into our University of South Australia community, the community adaptive sports programs gives them this pathway into the wider community. They get to interact with non-veteran specific organisations, and they get to start that reintegration process with the wider community. So these two things work hand in hand. So it's not quite that simple. There are many other things that run alongside of these two components. We have group goal setting classes, and I think we've heard from many speakers that setting and achieving goals is a really important process for people recovering and transitioning. We also run group classes, and that was off the back of some feedback from participants that they do spend a lot of time with their student trainers and they love that, but they would actually like some opportunity to come together as a group more often, so we've facilitated that recently. From a student perspective, it's been one of my roles as a clinical and academic director to facilitate more opportunities for interdisciplinary learning. Anyone who comes from a university here will know that everyone works in silos, and it's amazing how that happens by default. So there's been a big push to actually get our students to actively talk together at multi-D case conferences, where we can actually discuss the management with physios, podiatrists, psychologists, exercise scientists in the room together, with obviously staff facilitating, but also encouraging students to go down to the gym and watch a training session if they're the actual treating physio student, or vice versa, and the learning opportunities there are huge. We've heard from speakers just today how important evaluation of programs are. It's not good enough to say that the horse helped, was one comment before. So we do collect data. There is a PhD project that runs alongside the Invictus Pathways program, and Susanna Freegard will speak to us later this afternoon. We collect some psychological and emotional data. Obviously, the regular fitness testing provides us with physical performance data. And also next year, the aim is to include some student learning evaluation as well. So I'm keen to actually assess whether students' interdisciplinary learning or understanding of that increases as a result of participation in the program, but also whether they have become more comfortable working with people with mental health conditions, because that's one of the outcomes that we see as quite valuable. So what do we find? This is not a forum to present results. These are sort of anecdotal things for the moment, but like I said, there are studies underway. So for the physical performance side of things, stay tuned. I might be able to provide that at the next conference. But anecdotally, we hear participants will say, and if you get a chance to speak to any of them as well, I'm sure that they'll be willing to discuss with them how they feel about the program. They say they are fitter and stronger. It helps them to set goals. It helps them to find some direction. It helps them, for some people, to get off the couch and get out of the house to reconnect with their families. So anecdotally, we know that we're doing the right thing, but officially the evaluation results will tell us that soon. And that's just one quote from one particular participant, and just the words in blue just sort of stand out as some things that we're very proud of that the program can achieve. From a student perspective, we've also seen great gains. So it's an amazing opportunity for our students to gain industry experience. The University of South Australia is dedicated to promoting students or graduating students that have had real world life experience, and this is a perfect example of that. Alongside the Invictus Pathways program, we do also have a connection with the Australian Defence Force, where we help out with the Invictus Games cycling and swimming camps here in Adelaide as well. So our students get that connection with the Defence Force, which I think is invaluable. We also know from the students that they sort of say things to me like, I didn't know physios speak like that, when they're an exercise science student. And someone today did mention that we all do speak different language. So it is actually really important for our students to realise that if they're going to be our next generation of allied health professionals. They anecdotally do say that they are now more confident understanding mental health and dealing with mental health, and obviously dealing with those complex clients. So our growth since 2017, when it started, when Mark Reedy approached Roger Eston to say, can you help some of us get to a Games, has been amazing. So you can see we've gone from 7 participants and we've had 37 active participants right at this time this year. And we've gone from about 8 training students and we've gone up to 18. And just along the bottom is the achievement at the Games. That is only one measure of success. The life goals, to me, are almost more important than those of the Games, but the participants, some of them may disagree. But we've had great success about sending people to the Games as well. So just last points, where to from here, and that's possibly even the most important bits. So we are looking to increase the capacity, increase the scope. We're hoping to have 45 to 50 participants next year and up to about 25 student trainers, which is great for our student experience. We also are hoping to bring student involvement into the adaptive sports program. Now that's under the umbrella of the University of South Australia. We're also hoping to run camps, perhaps kayaking and rock climbing camps to kind of draw more students into the experience so that people can have a social experience as part of the program. We want to continue to develop, and for the OTs in the room, I've already had a discussion with some of you, we are pulling OT into the program after a scoping review this year, so that will be a new aspect to the program, which I think is very exciting. We are also hoping to develop a transition program, and we're working with a working group at the moment of participants to develop a plan as to how we can actually safely and happily transition them out of the program and integrate them into the community. And finally, we are speaking to some universities around Australia to hopefully roll the Invictus Pathways program out into other universities so that we can increase the reach of the program and hopefully improve the lives of more veterans and first responders around Australia. And then if anyone is interested, we would also be keen to consider going global. So I'd just like to acknowledge that staff and students and our major sponsor of the Road Home, they are all the people that make this program work. So thank you very much.
Thank you very much for that insight into the groundbreaking and, in fact, world first Pathways program, the Invictus Pathways program that began at UniSA and, as Katia said, hopes to spread it around Australia and then beyond.